Okay, well, look, let's start going. So, good morning, everyone. Welcome this Monday morning for our webinar, which is called Increasing Cervical Screening for People with Disability. I'd like to do an acknowledgement of country and acknowledge the lands that we're all meeting on today. I'm on the land of the Gadigal people of the Eora Nation, and I'd like to pay respect and honour elders past and present and Aboriginal people who have joined us today from other lands across the country. Aboriginal people have suffered through colonisation. It's a testament to the strength and kinship that we still have community today. Aboriginal people are the continuing custodians and traditional owners of the land, from the red dirt country of the centre to the green lush river country and saltwater country surrounding us. And this is artwork in the background by John Gilroy. So, who's presenting? Well, I'd like to just say hello to everyone. I'm Deborah Bateson. I'm a medical doctor by background, previous medical director of family planning, New South Wales, and a professor at the University of Sydney. And over to you, Marianne.
Thanks, Deb. Hi, everyone. I'm Marianne O'Donovan. I'm the Director of the Centre for Disability Studies and Associate Professor at the University of Sydney. I'm delighted to be here today. I will be monitoring the chat and the Q&A, so any questions, any comments, just keep them coming and we'll make sure that we'll get through them at the end of the session. And I'm delighted to hand over to the team who've been working really hard to get ready for today. And I'll start by handing over to Emily, please.
Good morning, everyone. It's an honor to be here this morning and to uh, talk to you about this webinar. I'm Emily. I've been the project manager on this, and I'll hand it over to Arena, who's also part of the team.
Yep. Hello, sorry. My name's Arena. I'm helping on the University of Sydney side, just coordinating things in the background, but very lovely to see everyone. And thank you for joining such an early time in the morning.
Thank you, Arena and Emily. We couldn't do this without you, so thank you for all your help, and to Edie and Lauren as well. And we're going to be meeting the cervical screening advocates with lived experience of disability who are going to share their experiences in the second half of this webinar. That we're going to be meeting Polly and Carleen. So just our learning outcomes for today. We're going to know that cervical cancer is one of the easiest cancers to prevent, to stop from happening. We're going to understand how the cervical screening test is done, including the new choice of having a self-collected or self-swab. We're going to understand the rights about cervical screening. And also think about what makes it difficult and what makes it easier for people with disability to have a cervical screening test. We're going to understand the National Cancer Screening Register and how supporters can help people with disability have a cervical screening test. And we're going to hear particularly from the disability screening, cervical screening advocates. Just a bit of housekeeping. Marianne's already noted that we've got a dedicated question and answer session at the end. So please do put your questions in the Q&A box for anyone to answer. All of the team can answer. We'll have a short break in the middle. We've got live captioning, so show captions in the meeting controls at the bottom, and then you can select your preferred language. We've also got Auslan interpretation. There's that world icon in the toolbar, but press on more if the icon isn't visible and select Auslan from the language list. So this is our agenda. We're going to have a background on cervical screening. We'll have a quick break around 8:25 to 8:30, and then we'll hear from the screening advocates and have our Q&A session. So let's have a look at cervical screening. Cervical screening is one of the easiest cancers to prevent. And this is because of the HPV vaccine. So HPV stands for human papillomavirus. And actually, Australia was the first country in the world to have a school-based HPV vaccine program for girls in 2007. And then we added boys in 2013. It's also because we can prevent it through screening, the National Cervical Screening Program. And this also changed. It changed in 2017. At the end of 2017, there was a change from pap smears every 2 years to HPV tests every 5 years. And we'll look at that in more detail. So Australia is predicted to be one of the first countries, in fact, to eliminate cervical cancer by as early as 2035. And the key thing is that this must be done equitably, including for people with disability. But let's have a look now at the human papillomavirus. It's called HPV for short, because this virus causes almost all cervical cancers. HPV is a very common infection. Most people get it in their lifetime, but usually it just goes away by itself. But sometimes the HPV can stay on in the body and sometimes can cause changes to the cells of the cervix. And these could lead to cancer in about 10 or 15 years. It takes a long time, but it's very important for us to check whether people have this HPV virus in the cervix. And where's the cervix? So this is a picture here, simple picture. The cervix is inside the body and it's at the top of the vagina. And these little animations are actually animated talking cervixes. There's one sitting at the bottom there, which we used in the Screen Me film, which was part of a campaign last year to raise awareness about cervical screening for people with disability. And we'd just like to thank the Australian government for all their support with these programs. So how do we prevent cervical cancer? I've mentioned it already. It's through the HPV vaccination for girls and for boys aged 12 and 13. It happens at school, but if people miss out at school on the vaccination, they can go actually to their GP and get a vaccination anytime up to the age of 26. In other words, up to the age of when you're 25, you can still get that vaccination. What about the cervical screening tests? Well, these are for women and any people with a cervix, aged 25 to 74 years, and this happens every 5 years. And this is Margot here from the Screen Me campaign with a lived experience of disability, reading her letter of invitation to screening. Now, the test can be done in two ways. One way, if we look on the right, is the doctor or nurse takes a sample of cells from the cervix using a special tool called a speculum that's used to open up the vagina so the doctor and nurse can see the cervix and take a sample using the soft brush you can see there being held by Dr. Yvonne, Associate Medical Director at Family Planning New South Wales. Another way the test can be done now is that you can actually take your own sample from the vagina using a self-swab. So what's this? You can see it there. So this is what it looks like. It's whoop, I hope I can show it actually. There it is. There it is. It's like a long cotton bud and it's inserted into the vagina and rotated 1 to 3 times. Very simple to do. And it really overcomes many barriers, as we'll see. The key thing too, though, is that sometimes people say to us, oh, I wouldn't be able to do that because of my disability, or I don't feel confident to do that myself. So you can also ask a doctor or nurse to help you take the sample from the vagina. But it's important to note that this should be a healthcare professional. It shouldn't be a paid carer, for instance, because doctors and nurses, of course, know the body, know the anatomy, and this is a very private thing to do. So don't forget you can ask for help, but it's great to have this new way of taking the sample without a speculum from the vagina. There's some common questions about the test. Is self-collection as accurate as when the doctor or nurse does the test with a speculum? And the answer is yes. Both ways are very accurate, and self-collection, self-sampling is just as accurate. Does having HPV mean that I have cancer? Many people worry about this, and the answer to this is no. Having an HPV infection, if HPV is detected or found on your cervical screening test, this can be very common. And the doctor or nurse will explain what to do to help prevent cancer. So make sure we understand all the facts. So what about follow-up after the cervical screening test? Well, you'll organise with your doctor or nurse how you're going to get those results. It usually takes about 2 weeks, 2 to 3 weeks. Sometimes the doctor or nurse might ring you, but sometimes they may get you to come back to the clinic for the results. Most people will have no HPV detected. That means the test shows no HPV and it's very safe to be tested in another 5 years. A small number of people will have, if you look to the right side, the pink or the red sections, this is where they have HPV type 16 or 18 detected. These are the types of HPV which are most likely to go on to develop into cervical cancer. The types are least likely to disappear by themselves. So we want to make sure that we can stop cervical cancer from happening. So we actually you're referred on to a specialist doctor for another special test. It's called a colposcopy to check what's happening with the cells of the cervix. Now, other people will actually have HPV detected, but there are other types of HPV types which are less likely to develop into cervical cancer, more likely to go away by themselves. And we know it's safe to wait and watch and test that person again in another 12 months, another year. It's important to know your rights about cervical screening. Your rights to have a cervical screening test. Everyone aged 25 to 74 can have a cervical screening test, but you can choose not to as well. It's your choice and right to see a female or male doctor or nurse, to ask for an interpreter. And as a person with disability, you can take a support person with you to the consultation. They could be there for some of the consultation, or all if that's your choice, or you could go, of course, completely on your own. And another important right is that, particularly if you're having a speculum examination and the doctor and nurse are taking that sample from the cervix, it is your right. You can say stop at any time during the test. If it's uncomfortable, you just want them to stop, that's your right. So let's have a look at what makes cervical screening difficult for people with disability. It can be at different levels. It can be at the society or community level, where there can be stigma and discrimination, which means that people with disability have less preventive health care. There can be financial difficulties. People with disability may not receive the same sex education at school and not know about cervical screening and their sexual and reproductive health. And we know, sadly, there are high rates of sexual abuse and even child sexual abuse for people with disability. And this can be a barrier to screening, particularly with that speculum test. So we want people to know that a self-collected test may help overcome some of these barriers. There can be individual barriers like fears and anxiety. People with disabilities say that having a cervical screening test can be scary or frightening, and they may have had past bad screening experiences. Again, we want them to know about the self-collected way of doing things, the self-swab. And healthcare providers, I'm one myself, we all want to develop as many skills and confidence in being able to provide services for people with disability. But sometimes we know we need some extra training. So that's part of the work that we're doing as well. We know that healthcare providers may have misassumptions about sexual activity, thinking people with disability are not sexually active and so don't need screening. We need to overcome that. There may be lots of competing health demands, and cervical screening may be put down to the bottom of the list. It's still very important, and the clinics themselves can simply be inaccessible. There can also be lack of accessible information and invitations or reminders to screen, again, costs to see the doctor, and sometimes families and support workers can be overprotective. Again, they may be thinking about their cervical screening experiences and not knowing that there's actually new ways of doing cervical screening now, and may feel that the person with disability shouldn't have a screening test, that it may be uncomfortable for them. But we need people to make their own decisions. And again, there can be misassumptions of sexual activity. And we want all families and support workers to know about how cervical screening is done. So what can make it easier for people with disability? Well, it's important to let the clinic know about any additional needs and supports the person with disability might have. People can ask for longer or multiple appointments, of course. And it's really important, if you need height adjustable tables, equipments and hoists, to talk with the clinic about this. We want more clinics to be able to provide these services. And of course, at the centre, it's about supporting choice, ensuring the person with disability can speak for themselves and is supported to speak up during consultations. We need to make sure there is accessible information. It's okay as well to delay a decision to have a cervical screening test. It doesn't need to happen today. If you feel you haven't got enough time or information, you can come back another time. People, of course, need choice about how to do the test, with self-collection as one choice, and understanding their rights is absolutely essential for everyone. So let's now move to the National Cancer Screening Register. The National Cancer Screening Register is an important system to understand. It's a personal electronic record. In terms of the screening register, it's for your cervical screening test. Shows, I'll talk about it in a minute, but it's around cervical screening, but it's also a register for bowel screening and for lung screening as well. So the register sends letters or SMS messages to screening participants. This is invitations that are sent to people when they're about to turn 25 years of age, inviting them to come and participate in the programme. And reminders are sent every 5 years for cervical screening as well. It also serves as a safety net. What that means is that if you're referred, for instance, to that specialist for the special test, and there's no record that that person has gone for that test, the register can follow up just to check what's happening. So that's important. It also helps to monitor just check how the program is running itself. So let's come now and meet Margot. Margot is a woman with lived experience of disability. Margot will turn 25 in 3 months. She gets a letter about her first screening test. Margot talks to her sister Augie, and they both go to the clinic together. Margot shows the letter to the doctor and asks for help with cervical screening. She's tried to read the letter, but she feels she needs more support about how to join and participate in cervical screening. The doctor checks the register, and she actually finds that Margot's phone number is actually out of date. So with Margot's consent, the doctor's able to actually update it with her new number. The doctor also lets Margot know that she could choose to have someone to help her take part in the National Cervical Screening Programme. This person is called a personal representative. Margot wants her sister, Augie, to support her. So she chooses Augie to be her personal representative. Augie is kind and listens to Margot. She understands what Margot wants. Margot says that she feels nervous about the cervical screening test, and she's glad that Augie will support her. The doctor gives Margot easy read information to take home, and Margot and her sister come back a week later. And at this point, Margot feels supported to actually have her first cervical screening test, and she chooses to take her own self-swab or self-collected sample. And the test shows no HPV has been detected. So she feels very happy about this, because what that means, of course, is that she can come back in 5 years. It's perfectly safe for her just to come back in 5 years. So Margot knows that she will get letters in the mail to remind her about future cervical screening tests through the register. She thinks it's quite a long way off to remember to come back in 5 years. So she's very glad that Augie is also going to get the letters to another letter in 5 years, because that will help her make an appointment. And just to let you know about the information that the doctor gave to Margot, she gave this easy read. She gave the links actually to these easy read booklets that have been co-produced by the Screen Equal study, which I've got the privilege of leading with people with intellectual disability. And this is Sarah, the star of the show in these booklets. There's a booklet on before my cervical screening test, during my cervical screening test, and after my cervical screening test. And we'll send you links to these information resources, which are on the National Cervical Screening Programme website. So what do we need to know about the register? Well, we need to know that there is what's called a participant portal. That's for people who are taking part in screening. It's accessed through MyGov. I'm sure you're all familiar with MyGov. It keeps a lot of your records in one place together. Medicare records, for instance, links to the tax office. But also you can link it to the cervical screening program, and it helps manage participation in the program. It enables that person to update their personal details, update whether they want SMSs or letters, to look at previous correspondence from the register. What it doesn't have, so this portal doesn't have personal test results. Those are private. Only that's between you and your doctor and nurse. So this has administrative information that helps you take part in the program. You can also, importantly, look at that screening status, including the date of your last cervical screening test, so you know when the next one is due. Now, what about the personal representative function? So the personal representative plays an administrative role in supporting screening participation for someone who chooses and feels they need more support. Most people don't need this more support, but some people feel it's a useful thing, like Margot. And it may be, it's not just for people with disability, of course, it's for other people who may not speak languages, English as their first language, and feel they want someone in the household to also be the personal representative to help read the letters. So who can a personal representative be? It's a trusted person. It could be a legal guardian, but it could be a family member, someone that's really close to you in your life. It's going to be there. And it could be a close friend as well. Generally, it could be, but generally it's not a paid support person, because we know that these people can change frequently, but obviously play an important supportive role as well. If you want to nominate someone to be a personal representative, then you can call the NCSR, the registry, or go online, and you can get someone, including your doctor or nurse, to help you do this. The supporters are, of course, absolutely crucial for people with disability in terms of getting cervical screening. It may be about taking people to the consultation, helping read through the information. And of course, supporters, the role is to help the person make their own choices. If people can't make the choice for themselves about having a cervical screening test, then that needs a legal guardian if they haven't got that capacity to consent. But generally, people can make their own decisions, and sometimes it takes a few consultations to be able to make that decision. And of course, supporters, having this ability to make your own choice respects the rights of people with disability to be in control of their own lives. And I just wanted to remind people about the CHAP, the Comprehensive Health Assessment Programme, which is an evidence-based tool for supporting the annual health assessments for people with intellectual disability. And it has information about screening, so really important as well. So I think we're going to have a little break now for a few minutes. It's early in the morning. You can get a cup of tea or a cup of coffee. I've given you a lot of information. I hope I didn't go too quickly. I do tend to speak a bit quickly. But let's take a bit of a break now, and we'll see you back at 8:30 with the cervical screening advocates. Thank you all. Well, welcome back, everyone. And just to say, we know you're a wonderfully mixed audience. We know that there are people with disability. We know that there are disability support people, family members, as well as healthcare practitioners and others who all want to improve cervical screening for people with disability. So we're now going to hear from the cervical screening advocates. And before we do that, I just urge you all, I see there's some questions have come into the chat, but do put questions into the chat or into the Q&A for us, because we will have time for questions. But now I'd just like to introduce you to two of the wonderful cervical screening advocates with lived experience of disability. So this is a pilot program, and we've got 7 screening advocates from across the different states and territories who've come together to share their experiences of cervical screening, learn more about cervical screening, work together on role plays, and we're going to be filming some segments for some training as well. And it's been a marvelous program. So I'm going to stop talking. I'm going to hand over to Carleen Plunkett and to Polly Seymour, who are first of all going to do a role play and then talk a bit about their experience and why they wanted to be screening advocates. So over to you both.
Thank you, Deb, and happy.
Carleen, I think you've gone on mute, unfortunately. We just need to take you off mute. I know it's very easy to make a mistake. Well done.
Sorry. Happy Monday, everyone. Hello, Polly.
Hey, Colleen, how are you?
Good. Here we are, two people with very different very different disabilities. Polly, yours is hidden, whereas mine is very obvious. It's actually we're both very proactive when it comes to our health, but there's much planning that goes on before having the cervical screening. Are you okay if I just pick your brain with 3 questions?
Yeah, of course.
Great. Alright. The first question I'm really keen to know about is, how did your disability impact you when doing or going for the cervical screening test?
So for me, being an autistic woman, a lot of my issues are quite sensory. So doctors' surgeries are incredibly overwhelming spaces for me because of the bright lights, which always overhead. Um, it creates yeah, I struggle with it. A lot of times the smells and the sounds are really overwhelming. So I have to make sure that I take things for me that are going to reduce those sensory experiences. So I use little earplugs for noise. Can't do much about the smell, unfortunately. So I will try to sit away from some of like the clinic rooms, like in probably a more isolated corner of the waiting room, if possible, or near a door. So if the smells are really strong, I can actually stand outside and then hear my name being called. But for the like the over like the lights and things like that. Um, I don't like wearing sunglasses inside, so I need to make sure that I'm actually looking down. So sometimes I'll take a book to read, and that's enough of a distraction as well to stop me from focusing on all the other things around me. But lately, I've been taking knitting. Because it's actually then good for me to stimulate my brain and focus on something. So my hyper focus is on this one thing rather than picking up on all the environmental and sensory things going on around me and not stress me out. And just making sure that the doctor and nurse are aware of my disability as well, especially if it's a new person.
Yeah, of course. The time I to keeping to consideration the how do you advocate for yourself?
So, um, my GP's known me for a long time now, so she's pretty good. But she, I think, sometimes forgets that putting me on the spot is not the most effective way to get me to engage. So for my last cervical screening, she kind of just popped up and went, "Oh, you're due," and just handed me the self-collection swab and just went, "You can just go do it now while we wait." Um, without I actually didn't know that self-collection was a thing, so that threw me out. So I didn't have any information beforehand. And I didn't know if she told me I could go to the bathroom to do it, but then I explained to her that bathrooms generally have those fluorescent lights, which are really overwhelming sometimes for me, especially if I'm anxious because I don't know what's going on. My dexterity in my hands may not be the greatest. I'm actually more likely to drop things. So I have a really bad habit of dropping my phones, for instance. Like that's a thing. So looking at that swab, which was quite small, I was worried that I was going to drop it. And then so I told her that I wasn't comfortable going to the bathroom. They actually let me use a nurse's office, like in a quieter corner of the doctor's surgery. So the lights weren't as bright. There was not as many sound. Like the sensory stimulation was minimized. And also the smells weren't particularly strong. So just being able to tell her that where she had suggested for me to go was not going to be an appropriate place was enough for me at that time. Um, Unfortunately, that screening test was not great, and I had to do another one, but I felt more prepared this time. So knowing what the self-collection looked like, what that meant, knowing that I could actually bring it home to do it, so it was in the safety of my environment, I felt comfortable, and then I could then take it back in was actually really important this time. So just explaining to her that if something needs to happen, like those tests or screenings, that I do actually need to be told before it and not just put on the spot. So that was a really important thing for me to explain to her and for her to learn too.
Well, it's very detailed, really, to this.
Yeah.
Uh, um, just something else I'm really curious about. As a gay person, did, uh, do you have uh, do you have uh, 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 the same risks as having HPV than heterosexual people.
I do actually. So HPV is not contracted through penetrative sex. It's actually contracted by skin to skin contact. So I am at risk, just the same amount of risk as everybody else, regardless of sexual orientation. So yeah, it's one of those things that you wouldn't kind of think would be a thing, but it is.
Yeah, well, thank you for letting me know.
That's okay. Do you mind if I ask you a couple of questions?
No, no, go right ahead.
Excellent. I'm just curious as to how a cervical screening actually works for you, for a person with your disability. What do you need to do to prepare and advocate for yourself?
Yeah. Well, being, as you know, that I live in a very tiny rural town uh, in Victoria. The town does have a doctor, but the doctor practices in a very, very uh, uh, old building. The building is has no doorways, has no corridors, so that means I cannot get around the clinic in my scooter, which is really disappointing. But yeah, that's how it is in this town. But I do travel 90 kilometers to a bigger town because they've got this really good uh, medical center. However, I need to block out about 4 hours for me to be able to go see the doctor. Unfortunately, telehealth is no longer available at that clinic. The medical clinic that I do go to is one that I can go into independently and because it's got appropriate parking. I I step free entrance. A really big room that you want to record in. They've also got the accessible toilet. Now it's gonna sound really trivial, but when you travel 90 k's, you really need to go to the toilet. That was a real coup for me. And they've got the really wide doorways, and they've got the adjustable bed. So when I do have to go and lie down, then I can do it in a safe manner. When I first see a medical practitioner, my partner comes in with me to interpret if needed. But however, I'm gonna pleased to say that the no longer need that support because the doctor and I have downloading that he could hear, that he listens to me, so we're on the same wavelength. When it comes to cervical screening, self collection isn't an option for me due to the sign of the swab. Ho- Hopefully that will change in the very near future.
Okay, thanks for that, Carleen. That's actually really interesting. And um, yeah, I guess you kind of don't necessarily think about the swab design, do you, sometimes? Do you mind if I ask you one more question, please?
Yes, I got,
So,
yeah,
my other question is, how does the cervical screening work differently for you now that you are, you know, like post-menopause, like have gone through that? So, what does that look like for you? And I guess for me, someone who hasn't gone through gone through menopause, what do I have to know about what that's going to look like, how that changes for me in the future?
yeah. Being my being partially for with me learning experience because your skin is a thin that gotta be really careful. So when I know that I have to have uh the screening test done 2 weeks prior, I had the hormonal cream that goes into the vagina, and it just helps to get the test done, and the pain is very minimal. Yeah, I take off, but thank goodness for the hormonal cream. Yeah,
It's a lifesaver.
it was. Yes, it is.
Yeah. Thanks, Colleen.
I must say, you two are the most fantastic advocates, and you've covered a lot of ground. It's fantastic. I mean, I think, just listening, first of all, that advice for postmenopausal women is really important, Carleen, because people sometimes don't know and sometimes don't get offered the option of vaginal estrogen. It's particularly important before a speculum examination and certainly before a specialist test as well. And you did mention about, and I know you're part of this study to redesign or co-design with people with disability a new type of swab, a device that can be used by people who have difficulty with the current swab. So that's fantastic. So thanks to Tessa Saunders and the work at Melbourne University. And Polly, I did just want to mention that HPV is very easy to catch, and you can get it through penetrative sex as well. But as you rightly say, it's not, people think it just has to be penetrative sex, but of course it doesn't. It can be just that mucosa to mucosa or skin to skin contact. So it's so easy to spread. So, but I must say, you're a fantastic advocate. So I just want to ask you both briefly, what made you become a screening advocate? So you're playing such an important role. So, Carleen, maybe to you first.
They do. Back in the 90s, so I was coordinating this peer program called uh, Perhaps I Should. And this was this was the statewide project to encourage people with varying disability to have practice. So I guess that my journey came from there and it's still here today.
Oh, that's wonderful to hear. Polly, what about you? What drew you to this program?
A big part of it has been my professional background, which has been in disability advocacy. So I've done that for over 11 years, and just seeing the inequality and inaccessibility for people with disability with regard in healthcare. So to be able to do this and actually educate people has actually been really important and really beneficial.
No, it's fantastic. Well, you're both like all seven of the screening advocates, really, fantastic. And it's so important to hear your voices about your experiences. And so, thank you for sharing. So, what we're going to do now, I'm just going to go pop through a couple more slides just to share with you. Someone asked in the chat actually, is can we see the Screen Me short film? And absolutely. So this was a short film made by Bus Stop Films, which is an inclusive film company, marvelous company, and Screen Me was the centre of this short film, 4-minute film, was at the centre of the campaign. It was a social media campaign that ran for 3 months last year that reached over 7 million viewers. And we do urge you all to go to this site because it's also got accessible information about screening as well. So thank you to the Department of Health for being so supportive in improving ways to look at how to improve cervical screening for people with disability and to design these with people with disability, of course. So vital. So just some messages to think about and take home. Australia wants to stop cervical cancer, and we recognise that no one, including people with disability, must be left behind on this journey. And self-collection or the self-swab can be a useful choice for people with disability. Support people have an important, crucial role in helping people with disability to have a cervical screening test. And people with disability may need extra support for follow-up after their test. If you have a self-collected sample and it shows those other types of HPV, you do need to go back to the GP or nurse for that speculum examination. So, and as Polly explained so clearly, it's really important not to be put on the spot, to understand what's going to be happening. So really crucial. And the same about going to one of those specialist tests. So having information to understand what's happening. The personal representative function of the register, the screening register, can be a useful tool for some people with disability. So have a think about whether this would be helpful for you. And we've got lots of accessible resources which we'll share with you. So we'd just like to acknowledge all of our partners. So Marianne at Centre for Disability Studies, myself here in the Faculty of Medicine, well, in the Sydney Medical School. We're delighted to partner together, and thank you to all the team as well. These are all the screening advocates here who are appearing in different webinars. But we'd like to hand over now to you for any questions to any of us, including, of course, Carleen and Polly, who have fantastic. So thank you. So over to everyone else. And I think, Marianne, you're going to facilitate these. I might just actually switch off this now so we can.
Great.
Just,
Thanks, Deb. That was wonderful. Thanks, Polly
yeah,
and Caroline. Such an informative conversation. I learned so much. I think I learn something new every time I come to a webinar. Really, really wonderful. There's no questions coming through in the chat and Q&A at the moment, but I might just ask a little bit about the personal representative function, because I don't think it's something that many people would know about. And so, how does it work in terms of supporting people with disabilities and particularly anyone with communication difficulties, Deb?
Yes, no, it's a good question. And we've been talking with lots of healthcare providers, lots of people with disability and their supporters. And I will say that most people hadn't heard about it. So that's why it's great for this webinar to be able to highlight it, because for some people it can be useful. So the key thing that it does, so if you're any participant, anyone who's having cervical screening can go to this participant portal, and it is that administrative function. If you're moving house, you can update your details so the letters come to the right address. It sends you letters. So the register sends you letters, and if you've got a personal representative, you can opt for that personal representative to get those letters too, or SMSs. So it means that you've got a backup, a safety net in a way to help. Like Margot in the webinar, she felt that she needed found the letter a bit complicated. She wanted someone to support her and understand it. So if, for instance, you're leaving the country for a couple of years, you could actually let the register know, and the personal representative could do that on your behalf, so you don't get letters when you're not in the country. And I think the other key thing is it's a way, the register, this participant portal is a way to actually check when you're next due for your cervical screening test. And so if you're a person with disability who feels you need help in accessing that participant portal, if you can't, you just want extra support, then that personal representative can do that for you and find out when your next screening test is due. I think sometimes people get a little bit mixed up with the personal representative and the role of the legal guardian for someone who is unable to consent to medical
Yes, I
procedures.
was just going to ask you that as a
Yes.
follow-on question, Deb. You read my
Yes.
mind. So yeah,
No,
great.
I think people get a little bit mixed up sometimes because I think that this personal representative is going to have the power to agree
Mm,
for this or disagree for, to have that substitute consent for having a cervical screening test, and it's not. This is purely an administrative supportive function. Very different for someone with a disability who is unable to consent despite everyone's efforts to support them, and they can make that decision on that person's behalf. But this is totally different. So it's a much less how would we describe it? I suppose it's an administrative function. Does that make sense?
that makes perfect sense. Yeah, and there's just then the follow-up question that's come in from Annie there, Deb. Are personal representatives only for cervical screening or other healthcare issues also?
Yes, it's a very good question. So as I mentioned, the cancer screening register, too many too many acronyms of this. The National Cancer Screening Register also includes bowel screening participation and now lung screening. So the personal representative, it's certainly on there for bowel screening, so it can be used for people for bowel screening as well. As far as I know, I mean, I think it's particularly for screening and helping people with screening, because we know that sometimes preventive health, in other words, having a test when you don't have any symptoms, can be confusing for people sometimes. So having that extra support is important. But I think it's an important question, and
Mm,
maybe we should be looking to sort of expand it more widely. And
mm.
of course, many people with disability say, "I think it's a great idea, but I don't need it." So
Yeah,
it's your choice. No one's forcing a personal representative on you to take over things that you can do for yourself. So
yeah,
I
I
don't know whether
think that's
Carleen and,
important.
and
Yeah.
Polly want to add in about the personal representative. What do you think, Polly and Carleen? Over to you.
I think it's definitely handy. And if you're someone like me who tends to forget things, or feels overwhelmed by the messages, like I've gotten the text messages to say that you're due, I'm still very likely to put it off. So if I've got somebody else that's getting those reminders that's going to prompt me or support me in doing it, it's actually really, really important. So it's definitely a handy function for a lot of people, I believe. Yeah.
Mm.
Right.
Great. Thanks, Polly. Caroline, did you want to come in?
No, not really.
There's one other question has just come in. I know we're coming up to the hour, but Anne asks, if a person gets the reminder letter but fails to do the test, will the person get any more reminders?
I think if there's a certain time passed, there will be follow up as well. So it is providing, as I mentioned before, that safety net as well. So
Mhm.
because the program, for people that are wanting to be screened, wants to make it as easy as possible for you to remember to make those screening appointments. So,
That
and
actually,
yes,
yeah, so you actually do get the reminders because that happened to me. So I got the initial letter and then I think another one or two reminders to remind me to go get screened. So it does actually, they do, like, until you have actually registered that you've done the test, they will continue to let you know.
Well, that is really good to know. Thanks, Polly. And thanks everyone for being here. Before we sign off, I'm wondering if Deb, Polly, and Caroline have a final take-home message that you want people here today to leave with. If there's one key message they should leave with and pass on maybe to someone else, as well as telling people that there's more webinars coming and please join. What would be your final message for the audience today? And I'll start with Caroline.
Uh, my key message will be cervical screening is just the same as kind of breast screening, having your bowel screening test done. Uh, they're all in the same basket. And we don't need to feel going to get it done.
Great. Thanks so much, Caroline. Yeah, get it done, people. And Polly.
Just that education is actually really important and don't make assumptions about people, whether they may or may not need the cervical screening. It's actually really important to get it done, whether you think that they may be sexually active or not.
Mm, yeah, it's a really great point and often overlooked, isn't it, for people with disabilities? Too many assumptions made. And final word to you, Deb.
Yeah, well, I think Polly and Carly, said it perfectly. But for me, it's just ensuring that people know cervical screening is for everyone aged 25 to 74 with a cervix, and do know about the new option of self-collection. We're already seeing over half the tests that are being done now are self-collected, and that includes people who've never been screened. It includes people we know, find it difficult to have cervical screening tests. People in remote areas, Aboriginal, Torres Strait Islander, people we want to be able to get more data around disability, which will happen soon. But we know that this is a really important new option for people who may not otherwise have been screened. So because they may have had negative experiences or bad experiences in the past. So just know the information, and everyone has the right to have preventive health care.
Yeah, fantastic. Great note to end on. And thank you all. What a wonderful panel, a wonderful discussion, so informative and very generous, particularly of the screening advocates, to share of your own personal experience as well. It's such a rich learning for all of us. And to everyone who's joined this morning, thank you so, so much for giving your time so early. Your Monday morning has started bright and early, and hope it's a wonderful rest of the day. So thank you all so much. Lots of thanks coming in and congratulations in the chat as well. So well done all.